Good morning. I'm Brian Barrett with Coldwell Banker Distinctive Properties.
And I'm Tara Myers with Distinctive Properties as well.
I'd like to welcome you to a series that Tara and I are going to do with horse professionals in the Kansas City area. And today we're privileged to talk to Doctors Kelly and Eric Carlson at Heartland Equine Clinic. I'll start off asking Kelly the first question, if that's okay. Could you talk a little bit about spring preparation for our horses and what we need to do for travel readiness? And maybe touch a little bit on somebody that doesn't really travel, what we need to do in the springtime versus somebody that competes on the road a lot.
Yeah, no problem. So typically in the springtime, it's a good time of year to think about an annual health exam for your horses, whether they're traveling or not. And then it's also the best time of year to think about the bulk of our vaccinations that we use for horses. So we vaccinate for what we call the core diseases. So that's something that all horses should get whether they travel or never leave the property. Those are diseases that tend to be fatal or really high mortality. So those would be things like tetanus, rabies, West Nile, and then Eastern and Western sleeping sickness. Our vaccinations work really well to protect against those diseases. And so that's something that every horse should get every year. We generally recommend doing those in the spring so they have the highest protection through mosquito season versus doing it in the fall and you're kind of losing your prime time through the winter. For horses that travel or horses that are around horses that travel, we also want to vaccinate against the respiratory diseases. So the most common ones that we think about are influenza and then equine herpes virus. And there's type 1 and type 4. Our vaccinations do cover all three of those things. So for any of our traveling horses, we recommend that. And if you're taking some horses off to go compete or trail ride or whatever, and then bringing them back home and exposing the rest of your herd, we recommend doing the rest of the herd for the respiratory diseases as well. Those vaccines do a good job, but they only provide about 6 months of good protection. So we recommend reboostering those in the fall if you're going to be traveling any through the fall or winter.